out during your X-ray clinical rotations? In this video, you'll discover the 8 things every X-ray technologist expects from a radiography student, from professionalism and patient care to positioning skills, communication, and clinical confidence. The same habits that can earn trust, more hands-on experience, and help you succeed on the ARRT Registry Exam. So whether you're a first-year radiography student or getting ready for your next clinical rotation, these practical tips will help you get a great impression and avoid common mistakes and become the student that every X-ray technologist wants to work with. So 8 tips for a successful X-ray clinical rotation. Let's get started. Number 1, show up prepared to clinic. Techs expect students to show up on time in proper uniform with their X-ray markers, their dosimeter badge, and a positive attitude. They should have reviewed the exams that they're likely to perform the day before. So you want to make sure that you're arriving to your clinical rotations 10 to 15 minutes before your rotation starts. This shows that you are prompt, that you are prepared, and that you are ready for your clinical rotations. Make sure that you have a clean uniform. Make sure that you look professional. If you have long hair, make sure that you pull your hair up so it's off your collar and out of the way during your clinical rotations. Also, make sure that you know the basic anatomy and positioning before you ask the X-ray technologist questions. If you want to review like image analysis or go over some of the anatomy that's needed for the particular projection that you're going over, make sure that you prepare yourself ahead of time and know what anatomy needs to be included for the exam that you're performing. Number 2, be willing to help. Clinicals are about participating, not observing from the corner of the room. So help transfer patients. If you are in the X-ray department and you notice that someone needs help with assisting a patient to the bed from the stretcher, offer to help. If you are unsure how to do it, the X-ray technologist will show you how to transfer the patient. This helps the X-ray technologist, and it shows that you are motivated and that you are taking the initiative to help out in the department. Make sure that the X-ray rooms are cleaned and stocked ahead of time. Before you even bring your patient back to the X-ray room, you want to make sure that you have all of the necessary supplies in the room and that you're set up ready to go. This means making sure that your workstation is set up, you have the correct name pulled up, you have the X-ray equipment set up for whether it's a wall or a table bucky exam, you have X-ray tape in the room, you have your lead markers, you have a sponge that's ready and available if you're going to be doing any positioning with the sponge. Make sure that you have sheets, blankets, pillowcase, pillow, that you have an emesis basin available in case the patient feels nauseous during the exam. And again, make sure all of this is set up, prepared, and stocked and ready to go before each of the exams that you perform. Prepare the X-ray rooms again for the patients. Make sure that you have wheelchairs and stretchers available to assist the technologist. Say, for instance, you go out to outpatient and the patient you notice isn't very steady on their feet. You want to make sure that you know where the wheelchairs are and that they're easily accessible to you and that you can go grab that quickly for the patient. Or if you're in the X-ray department and you overhear the X-ray technologist in the other room say that they need a wheelchair, take the initiative to go grab that wheelchair for that technologist and for that patient. When you're willing to help, you're offering to assist whenever and wherever possible in the X-ray department. Number 3, know your positioning basics. No one expects students to know everything, but they should know the fundamentals before entering the X-ray room. So number 3, make sure that you know your positioning basics. For instance, if you know you're going to be working in the ER or if you know you're going to be working in the OR, you want to make sure that you're reviewing the anatomy ahead of time. Don't go into your clinical rotations without reviewing this information. It's going to help you feel more confident and competent during your clinical rotations. Know the correct patient positioning for the exam that you're performing. So for instance, if you are doing an abdomen x-ray, double check the order. Is it just a KUB or is it a flat and upright? Because that's going to determine how you position the patient. You want to make sure that you know your CR placement for both an upright abdomen as well as a KUB. Know the SID. Are you doing a 40-inch SID or a 72-inch SID for the exam that you're performing? Make sure you are collimating. If you have a tiny patient, you do not need your collimation opened wide. Make sure that you are utilizing the collimation on your x-ray tube. Make sure that you're giving proper breathing instructions for the patient. So for instance, if you are doing an upright abdomen, you want to make sure that you are using inspiration. So you'll tell the patient to take in a deep breath, hold their breath, and then for a KUB, you're going to have the patient breathe on expiration. So for that, you would say, take in a deep breath, blow it all out, and hold it out. Make sure that your image receptor is properly aligned. If you are moving the x-ray tube and you're trying to match it with the bucky, make sure that they align properly before taking the x-ray exposure. This will help to avoid any repeats. And also know that there is a difference between clinical versus didactic experience. So for instance, you will learn all the necessary positioning and the basics of anatomy and positioning in class. However, just know that when you come to your clinical rotations, you will do that basic positioning. However, there will be times where you have to modify or be creative. So for instance, you're in the ER and you're working with the patient and your typical knee projections are not ones that you can do with this patient. Why? Maybe the patient can't bend their leg. Maybe you can't get that tunnel view that is the typical protocol of where your clinical rotation is. So the tech that you're working with will probably modify or be creative in how they are getting the projections that they need for the radiologist. So if you are doing a trauma, you might not be able to do the basic x-ray positions of the knee. You might have to do internal, external knees. You might have to angle the x-ray tube to get the view of what an internal knee would look like or what an AP knee would look like. Or maybe you have to do a cross-table lateral knee x-ray instead of doing a basic knee projection with the patient rolled up on their side. So just know that, yes, the basics of doing your anatomy, positioning, your anatomy and the positioning that you learn while you are in class is important and you will use those skills, but just know that clinicals, you will have to use modifications or some creative aspect of obtaining the x-ray images. Number 4, communicate professionally with patients. Students should introduce themselves, explain the exam clearly, and speak respectively to every patient. You're verifying the patient's identity. So when you go to get a patient or you have a patient come into the department, you are introducing yourself. You are explaining the test and the procedure to the patient. You are checking their armband. You're asking them their name and their date of birth. You're confirming that on the armband as well. You're going to give clear instructions to the patient in terms that they actually can comprehend or understand. You want to make sure that you're showing empathy and patience. Not all patients will be walkie-talkie. They will not be able to get on and off the table easily. You will need some assistance from some of the other x-ray techs in the department. So you want to make sure that you're taking your time, speak clearly to them. If you are working with an elderly patient, make sure that you are taking your time, speaking slowly and clearly so that they can comprehend what you are saying. If you have a pediatric patient, you're going to have to explain it into terms that they can understand. So for instance, if you're doing a chest x-ray on a pediatric patient, say they're 7 years old, you want to explain to them, we're going to take an x-ray of your chest. This is our camera. You're pointing to the x-ray tube. You're explaining that that's the camera. It's not going to hurt. It's going to take a picture, look at my light, and then after we're done, I'll show you the pictures of the x-rays. So again, make sure you know who you're talking to as far as your audience, and then make sure that you are speaking clearly and in a tone that they can understand. After the procedure is done, you want to explain to the patient what happens after the x-ray procedure. So you want to make sure that you say, after the x-ray is done, the radiologist will read your x-rays, and then within 24 hours, your doctor should have the results. If you have an account online where you can go in and check the readings, you can go in and check your chart, and then you'll have the results sent to you via email. Number 5, expect feedback without becoming defensive. So as a student, you want to make sure that you are listening carefully to the technologist. Students should ask the technologist how they can improve. Students should apply the corrections on future exams and procedures and be willing to work with everyone. You will work with several different X-ray technologists, several different personalities. Not all X-ray techs do everything the same. That doesn't mean they're wrong. It's just a different way of learning. It is a way that they have found useful before because they have been in a situation where they needed to maybe be creative or think outside of the box to get an exam, and getting that experience from all types of different personalities and technologists is going to help you perform better as a student and eventually as an X-ray technologist. Number 6, stay busy and take initiative. Avoid standing around waiting for someone to tell you what to do. So there's always something to do in clinicals. Students should be asking, how can I help? Be proactive and willing to perform exams. You don't need to be standing around in the corner or studying your notes during clinicals. You want to make sure that you are utilizing your time effectively and taking every opportunity to work with technologists and assist where you can be needed. Review your images and know what evaluation criteria is needed. Practice positioning and learning the X-ray equipment in between exams. And then also observe unfamiliar procedures or exams. Students should prioritize patient care and safety. Image quality is important, but patient safety always comes first. Practice radiation safety and ARRT principles. Again, ARRT means as low as reasonably achievable. Make sure that you are practicing your radiation safety at all times. Verify pregnancy status when appropriate. Make sure that you are locking the wheelchairs and the stretchers to prevent patient falls. You're following infection controls and procedures, and you're complying with patient confidentiality and HIPAA protocols. The only reason that you need to go into their medical chart is if it is a patient that you are doing an exam on. Number 8, have a positive attitude and be eager to learn. Clinical rotations can be stressful, but attitude makes a lasting impression on techs working with students. Techs enjoy working with students who ask thoughtful questions like, why did you use that angle for that projection? Maybe it was a different way of getting that projection and you want to understand why. Ask the technologist and they'll explain why they decided to use the angle that they did for that exam that they performed. Stay engaged and busy. Make sure, again, that you are not standing around, that you are finding something to do. You're in an X-ray room, you're practicing positioning, you're using the equipment to get familiar with it, you're getting comfortable with the workstation, you're stocking the rooms, you're helping out with the X-ray technologist, you're assisting by getting a wheelchair or a warm blanket for an X-ray technologist. There is plenty to do in the department. If you're not sure of what to do, make sure you are asking an X-ray technologist. They will be sure to guide you in the right direction. So remain humble and willing to learn. There is so much to learn. Again, so many different personalities in the department. Be willing, again, to just ask questions and learn and soak up as much knowledge and experience as you can during your clinical rotations. Work well with the healthcare staff. Again, ask questions to learn more and learn from both your successes and your mistakes. You'll make plenty of mistakes. You'll have repeats. I still have repeats as a technologist. These mistakes help you grow as a student and as a technologist. You learn from the people that you work with. You learn from the patients that you have, and it helps to build character and it helps you to become a better X-ray technologist. It helps you to think more creatively and to just use the skills that you have and be willing to share those skills with other people because that helps them grow as a technologist and as a student as well. If you focus on these 8 X-ray tips throughout your clinical rotation, not only will you become a stronger X-ray student, but you'll also build the confidence and the skills needed to succeed on the ARRT Registry Exam and in your future career as a radiologic technologist. If you found this video helpful, please like and subscribe for more radiography tutorials, positioning tips, image critique, ARRT Registry Exam preparation, and clinical success strategies. Leave a comment below and tell me, which of these 8 tips do you think will make the biggest difference during your clinical rotation? Or what advice has helped you the most? I'd love to hear your experiences, and your advice may help another radiography student on their journey. Master X-rays one at a time. Subscribe for weekly X-ray tips. Thanks for watching, and I'll see you in the next video.